One local woman suffered from pain so severe it could knock her down for 24 hours at a time. Neurosurgeon Dr. Greg Thompson performed surgery that changed her life.
Laurie McCarty lives an active life, motorcycle rides, NASCAR, time with family and friends. But for years, pain got in her way.
I feel like I've had headaches, but they weren't really headaches. It was always at the back of my neck, and it's bothered me for years and years. But I would say it got worse over the last 5, 6, and then the last 2 was really bad. I would get them maybe once a week, and then towards the end, I was getting them. There's often times when I'd have them 3 or 4 times a week. Sometimes they'd even last like 24 hours. And it would just, the back of my neck would just hurt. I went to physical therapy, I had cortisone injections, and they basically told me that it was arthritis, that it was just something I had to live with.
In February 2020, her sister encouraged her to get an MRI after experiencing similar pain.
When I went to see Dr. Thompson, he looked at my MRI and said, no, whatever you've been doing won't help because it is discs C5 and 6, and he explained to me what they were going to do. And I was just so happy that finally I'd found a doctor that understood me and was going to take me in the right direction.
There are 7 bones that make up the neck, and in her circumstance, between 5 and 6, it looked like there was a lot of wear and tear, a lot of wearing of that joint space or that disc space. And we were seeing bone spurs, which often will put pressure on the spinal cord or the spinal nerves. The disc space is collapsing. That's the disc between the vertebra. And as that collapses, that tends to crimp or put pressure on the nerve channels. In conjunction with that, it usually causes bulging of the discs, and the bone spurs are a method of the body to try and stabilize this space.
Dr. Greg Thompson told Laurie she was a good candidate for cervical spine surgery.
He was so reassuring, very calming, that I just trusted him. I knew that I had gone this long, I'm finally on the right path, I finally got to the right doctor, I'm pushing through, and he made me feel very, very comfortable in going through with this surgery, knowing that even though there were risks, the benefit was so much better.
The surgery is fairly well tolerated, an operation here in the neck, and we just work through normal anatomic channels, and so we don't have to cut a lot of muscle. There's typically not a lot of pain with the operation. The most common complaint we get after this surgery is really swallowing difficulty, because we have to retract the swallowing or the esophagus out of the way temporarily to do the work. While we're doing a big surgery around the spinal cord and blood vessels and the esophagus and so forth, the patients wake up and they don't feel like they've been put through a big surgery because we're not cutting a lot of muscle out of the way.
After years of that pain, she was ready for surgery in July.
I remember waking up in bed with the brace on, but I wasn't in pain. I was fine. It's a miracle. I do believe that the way I'm healing and as fast as I'm healing and with the way it looks, it was a blessing to have happen in my life. I'm so glad I found the right doctor, that somebody referred me to the neurosurgeon, even though I had a neurologist.
Laurie's scar is fading. She's ready to jump back into that busy lifestyle.
To know that every day when I woke up, I didn't have to wonder, well, at some point today, is my head gonna hurt?
This time, pain-free.
I haven't hurt since. I haven't had any twinge like, oh no, I'm gonna get a headache. It's really gone.
You may have noticed Laurie was wearing a brace in portions of that video. That was just temporary. Her only other long-term care involves periodic imaging to make sure everything is fusing correctly. Recently, Liz got to sit down with Dr. Thompson to talk more about Laurie's surgery.
Joining us now is Dr. Gregory Thompson, neurosurgeon at Penn State Health St. Joseph. We're so glad we found you too. Laurie mentioned several things she had tried before surgery. Can we talk a little bit about that? And is surgery a last option?
Usually we like a period of non-operative care before we try surgery as a treatment option, mainly because surgery carries more risk and so forth. But in general, with patients with neck discomfort or degeneration of the cervical spine, we try physical therapy, some anti-inflammatory medications, heat, ice, massage at times, sometimes chiropractic treatments and so forth. And then at other times we might also try an injection in the neck to try to ease some of the pain and discomfort and inflammation in the nerves and so forth. So for most people, they'll respond to one or more of those forms of treatment, and a few patients will then not respond and need surgery. We also use surgery as a last resort because it carries more risk, and then surgery requires that we fuse or link a few spinal bones together, and the fusion limits your mobility and range of motion after surgery, and it also takes time to heal, like 3 months or so for the bones to knit themselves together. And during that healing process, the recovery can be, for some patients, a little prolonged.
Laurie was released from the hospital the next day, the day after her surgery. Is that typical?
For this operation, it is typical. And, because we're working in and around the swallowing and breathing tube, one of the concerns we have is for swelling of those structures and being able to swallow after surgery, or certainly being able to breathe after surgery. On very rare occasions, someone will develop a blood clot. There'll be bleeding from the operative site, and that will put pressure on the swallowing and breathing tube. So we really just monitor patients mostly for breathing and swallowing issues. We also have the ability to give them a few doses of antibiotics after surgery to lessen the risk of infection, and then can monitor their blood pressure and their pain control and make sure they're adequately treated with reference to pain medication.
Before we go, what is the typical prognosis following cervical spine surgery, and will Laurie have a pain-free future? We hope.
Yes, I think Laurie is going to do quite well and have a pain-free future. And I do think it depends, of course, on the diagnosis, but in Laurie's circumstance, when we fix one disc space, that has a very high prognosis and very good prognosis. So for neck pain in that setting, it's 70 to 80% effective. For arm pain, shooting arm pain, it's more like 80 to 90% effective and so forth. One of the concerns we have long-term with the fusion procedure is over time it can cause strain or stress around the disc spaces that are not fused. And then periodically we may need to monitor if she has a flare of neck pain or arm pain. But other symptoms would be headache. Patients frequently get, of course, shooting arm pain, weakness or numbness in the hand or the arm. Some patients will describe numb clumsiness to the hands and difficulty with walking or balance.
Well, we learned about tech neck, which means it's another great reason to put down your phone right now. Thank you so much, Dr. Thompson.